Former aerospace engineer Rudy Michaelis and his wife Ruth Ann are enjoying their retirement years. But 3 years ago, Rudy noticed a problem developing in both of his hands. The condition was diagnosed as Dupuytrens contracture.
And what it does, it just starts making it so that your finger can't straighten out, and with time, it'll just end up curling your finger more and more and more over, and then pretty soon it becomes virtually non-functional.
Dupuytren's disease is generally an inherited disease where people develop contracture cords or collagen bundles in their palm. The problem with these scar bands is that they can shorten over time, and as they shorten in the palm, they draw the fingers down into contracture. So you can get fingers that look like this or like this, and that's a real problem for people because obviously that would affect function and the ability to use their hand.
Good to see you.
Good to see you. How are you doing today?
Pretty good.
Dr. Benhaim regularly performs surgery on patients to correct Dupuytren's contracture, but he is also one of a handful of doctors throughout the country who is highly trained in a minimally invasive technique called needle aponeurotomy. Rudy is undergoing this minimally invasive procedure today.
The most common technique really is regular conventional surgery where you open up the entire palm and one or more fingers, depending on how far it goes out into the fingers, to remove these scar contracture bands in the palm. That's a big operation. For lack of a better word, you have to fillet open the whole hand to get this material out of there.
By contrast, needle aponeurotomy is performed with local anesthesia. Rudy's hand is numbed with Novocaine and a cold spray.
Very cold. We take a needle, a simple regular needle that you take a blood test with, for example. Michaelis, you ready?
Yes.
And we just open up the palm, and wherever the scar contracture bands are, we take that needle and literally just go back and forth in a windshield wiper fashion, releasing the tension in that scar tissue. You can even hear it. Hear the cord there?
Dr. Benhaim slowly makes his way along the diseased cords in Rudy's palm, scratching and scoring the tight, thick bands just beneath the surface of the skin.
It's all based on feedback. It's like going through gristle. If you hear that gristle sound, then you're okay.
He can't see the bands, but his experience allows him to hear and feel them and visualize the underlying anatomy.
In terms of major complications, there is a risk for cutting a nerve because this is a blind technique, but the numbers have shown over thousands of cases that the risk of cutting a nerve is only about 1 in 100, about the same as with conventional surgery.
In 30 minutes, Dr. Benhaim is finished. He is then able to bend or hyperextend Rudy's fingers backward, freeing them from the crippling cords. And the results are immediate.
Okay, open your hand. There you go.
Oh my God.
Make a fist. Everything works.
Look at that.
Isn't it incredible?
Straighten it up now.
Compare it to this.
Yeah, look at that. In most of these patients who have this procedure, they can go back to using a hammer or a screwdriver in 7 days as opposed to 3 or 4 months.
That's wonderful.
Okay, good.
God bless you, doctor.
It's immediately gratifying. You'll see right there on the table that their finger is straighter. Patients are wide awake during surgery, so they know immediately that their finger is straighter.
The real benefits of the process are that instead of having an 8-week period of in-cast and then rehab for an extended period of time, in a matter of a week, everything will be pretty much back to normal.
Rudy's right hand healed in a matter of days following the procedure, and he says he will have the same procedure to straighten his left hand in the next few weeks.